Hi, I'm Jack Andraka with The Scoop, and we're here with Professor Lorig from Stanford University. And we're here today to talk a bit about your work, which involves a lot about patient involvement, especially unilaterally with Spanish and English speakers.
And about 20 other languages as well.
So I saw that you were initially in the Peace Corps. So how did you go from Peace Corps to medicine?
Well, I was actually, my original education was in nursing, so I was actually a nurse in the Peace Corps. And the more important question is, how did the Peace Corps get me here today? Because what I learned in the Peace Corps working in Chile was that peers who basically ran the healthcare system of Chile did an incredibly good job with very little training. And that has influenced everything I've done since, because the power of patients, not only to help each other, but to be part of the healthcare system, has been kind of central to everything I've ever done.
Awesome. And so how do you make it such that people, regardless of what language is their first language, how do you make them feel comfortable as patients, for example?
Well, you do things within their own culture, and you have people that speak their language do the teaching. So if I'm going into a barrio in the United States, the people that are doing the teaching are people that are their neighbors. I do our training in Spanish. A lot of our leaders don't speak English. I mean, just because I speak English doesn't mean that they have to speak English. If we're going into rural Kenya, the leaders speak Kikuyu, and the people that do the training are Kikuyu. So all we really have to do is have bilingual trainers who then go back and work in their own language and do the cultural adaptations that are necessary for their own language.
Awesome. And so if you could say any one part of your program that's absolutely key to its success, what would you say it would be?
Peers teaching peers, good training, listening to patients and building programs on patients' perception of their lives and their disease rather than on what professionals think they should be doing.
And what advice would you have for other doctors who are trying to have this multinational perspective training program?
Listen.
Well, great advice. And so thank you so much for taking the time to talk with us. For The Scoop, I'm Jack Andraka.